Introduction. I'm Rob Lieberthal, and I'm the health economist for the PCMH cost study, which is the cost of sustaining and transforming for the patient-centered medical home model. I'm going to be talking about a cost tool that we created in order to collect the cost of transforming to and sustaining the PCMH model. So this is a tutorial and orientation to our cost tool. I'm going to flip over to Microsoft Excel. So this is a draft for discussion, and there's also a PDF version of this. So let me start by reiterating the purpose of this tool, which is we really want to collect the cost of the patient-centered medical home model from the point of view of a primary care practice and focus on the perspective of smaller practices, meaning practices with less than 10 full-time equivalent providers. So we created this tool with that aim in mind. The second thing that I want to say about this tool by way of introduction is that we created it in Microsoft Excel. So anything that you can do in Microsoft Excel, you can do in the tool, and any familiarity that you have with Microsoft Excel will help you in filling this tool out. Conversely, if you have any questions in terms of filling out the tool that you think relates to Microsoft Excel, just like with any questions with the tool, we'd be happy to try to answer your questions. Our experience suggests that since Excel is the most popular spreadsheet program out there, most people should at least be familiar with Excel. And then for a lot of people, this is a key tool to use in budgeting and collection of data, both financial and clinical. So so we felt that it was the best way to go in terms of making a tool that would be useful to as many practices as possible. So just like any Microsoft Excel spreadsheet, our tool is an Excel file that has a lot of worksheets. So there's a lot of tabs that make up the whole spreadsheet. So I'm just going to move my mouse down here to the bottom, and you can see that right now we're in this sheet called Navigation Sheet Start Here. So just like any Excel spreadsheet, you can click on another tab. This is the Classifying the Practice tab, Practice Size, and that is how to navigate across Microsoft Excel spreadsheet. So we use that functionality of Excel to design worksheets that would assess the different components of the cost of the patient-centered medical home model. So I'll just point out right now one feature something you can do in Excel that might help to make this a little bit easier to see on the screen that I'm sharing. Is like anything else in Excel, on the lower right-hand corner, you can change the zoom. So I'm just going to push the minus button and zoom out. And now you can see the list of all the worksheets that are going to be in this spreadsheet just by, like I said, just by zooming out. So this may be too basic for some. Just to show you, this is zooming in and out in Excel. So now that I've zoomed out a little bit, you can see that there's a total of 26 sheets in this Excel spreadsheet. So the first sheet is this one that we're on right now, which is the navigation sheet, Start Here. And then the other 25 sheets are designed, again, to assess the cost of the patient-centered medical home model. So on this first sheet, the navigation sheet, you can see that in column A we have a list of all the tabs that are in this spreadsheet. So even though, as I said, you can navigate through the tabs just like you would in any spreadsheet in Excel, here up front you have a list. These are all the tabs that are going to be filled out as part of this tool. In column B, we've put in some information about the type of worksheet. So the majority of the worksheets are going to be for you, the practice, to input data. That's what it means when it says input. And the majority of the sheets are going to be core information, meaning information that's applicable to any patient-centered medical home primary care practice. There are a few sheets down here. For example, if you look at row 15, this one says input, if applicable, physician tasks. So for example, some primary care practices are nurse-run practices. They don't have physicians working as providers. They wouldn't use this sheet. Nurse care managers, some practices don't have a separate nurse care manager, so that is why we've labeled this sheet if applicable. So finally, in addition to these input sheets, at the bottom there's 3 calculated sheets. And those are sheets that we're going to fill in to allow us to take the data that you input and to calculate the cost of sustaining the model, the cost of transforming to a patient-centered medical home, and then the total cost of the patient-centered medical home model. If you go to those sheets in the version that we send you, you'll see that we've not enabled that function yet. So in other words, when you input data, what you're going to send back to us, or what you'll have at the end, is the raw data. And then we're going to put in the formulas to turn that into the cost of the patient-centered medical home. And that was a decision that we made for research purposes. And as we've mentioned before, we hold the proprietary nature of all of our practices data very seriously. So we're not going to have the practices sharing their data with each other, certainly. But something that we could discuss that might be very useful to practices is to see, once we've taken the data and turned that into the cost, for your practice to see the cost of the model could be really useful. So if you go into those sheets right now, you'll just see the shell of how we're going to organize all that data, but you won't be able to see your costs while you're filling out the sheet. The final column in this navigation sheet has the label complete/incomplete. What that's going to allow you to do is to see for each sheet, have you filled out all of the questions that we've put in. So right now, in the version that we have up and the version that we'll send you, it's going to be completely blank. All these sheets are incomplete, meaning there's no data in there. So by looking at this navigation sheet, as you fill out the tool, you'll be able to see which sheets have you finished and which sheets you have not finished. So that's the purpose of this complete and incomplete toggle. And some of them might stay incomplete. For example, if one of those if applicable sheets doesn't apply to you, then that would stay incomplete, and you would just send us back the Excel spreadsheet as it is. This is, again, designed to be an aid to help you figure out your progress in filling out the tool. So something else I want to explain and bring everyone's attention to is what's the purpose of these sheets. So the navigation sheet is a really good place to go through the total scope of the data that we're asking for. So as I said, we're trying to estimate the cost of the patient-centered medical home model. So we're going to do that by collecting a number of different types of data. The first type of data is going to be general data about your practice. So you see there's 5 sheets here from 2 to 6 about classifying the practice size, and patient panel, financial scope, and payment arrangements. So this is data we're going to collect about your practice so that we can translate some of the other data you give us into actual costs. What I mean by actual activities, that relates very strongly to the next 6 sheets, which may be very familiar to you as the 6 areas for Ncqa recognition as a patient-centered medical home. Access and continuity, identify and manage patient populations, and so forth. So each of these sheets contains clinical activities that make up each of these areas that we identified based on the survey and based on the interview that we did with each practice. So that's how we use that data to create this cost tool. And I'll dig into some of these sheets a little bit more to show you exactly how we're going to collect that data. Next, I wanted to highlight these 7 sheets that are all called tasks, like space tasks and equipment tasks, and so forth. So one very important finding from our study is that there are a lot of activities that practices have to undergo to become or to remain a patient-centered medical home that don't fall cleanly into one of those 6 areas for Ncqa recognition. So for example, in terms of a nurse care manager, especially for smaller practices, it's simply not feasible to hire a nurse care manager, simply to achieve, the Ncqa recognition goal of measuring and improving performance. Instead, it's most likely that a nurse care manager was hired to fulfill a number of requirements for recognition as a PCMH, and also possibly to fulfill other practice goals, like having certain types of visits that you can bill for. So the reason that we have these 7 sheets, which again are these rows 13 through 19, are to assess tasks and other aspects of the practice that generate costs that go along with becoming a patient-centered medical home, but that don't fall cleanly into one of those 6 Ncqa areas. Next, if you see in row 20, we have collaborations and outside programs. Many practices were part of a collaboration like the Chronic Care Initiative that resulted in incentives and other activities that were part of becoming or remaining a PCMH. So that is why we have that sheet. And then the last 2 sheets I want to highlight are practice culture and certification costs, which are rows 21 and 22. So practice culture is identified as very important and potentially very costly for becoming a patient-centered medical home. For example, changing the orientation of the people that work in the practice to think of themselves as working in a cooperative way, team-based environment, and so forth. However, one of our findings in our research is that because PCMH is patient-centered, that the costs of changing the culture of the practice are not really well captured by the standards for Ncqa recognition. So we put in a whole separate sheet that's going to capture all of the costs and potentially the benefits of having a change of practice culture so that we can adequately capture all the costs of becoming and remaining as a patient-centered medical home. Finally, certification costs. Again, this is not an area for recognition by Ncqa. This is more about all the time it took for each practice to fill out their application, and any fees that were actually associated with becoming recognized as a patient-centered medical home. That would go in this certification cost worksheet. So that, as I said, that explains all of the input worksheets, and then we have these 3 where we'll calculate the costs. Finally, if you see down here, there's something called drop-down menus. Something that I'll show you when we drill into a few of the sheets is that we've created pre-populated drop-down menus to make it easier for you to enter data for a lot of our questions. So the drop-down menus really facilitate that function in Excel. So while they're in there, and there's something that you can look at, we would just ask that you leave them as they are. We want to be transparent so you can see them, but really they allow the whole spreadsheet to function. And I'll show that to you a little bit more as I drill down into some of these sheets. So I'm going to drill down into two specific sheets in this worksheet, again, to show you how the data is actually going to be entered. And as I do, I'm also going to show you some of the functions that we put in to make it easier to move between these worksheets. So as I said, this is a Microsoft Excel spreadsheet. So the sheet that I want to go to is the financial scope worksheet. You can see that here. So one way I can do that is through the general Excel functionality, where you see this button that allows me to go to the right and scroll through the tabs. And I'm just clicking on that button, and it brings up the tab. So I can just click on it here. Click on it with my mouse. Something that we wanted to make very easy is for you to move through these worksheets. So one way that we've done that is in each sheet, if you look over to the right, and I'm actually going to zoom out so you can see this, we've placed this blue button here called Navigation Sheet. And anytime you click on that, it'll just bring you right back to the original navigation sheet. And then the other thing that we've done is taken each of these worksheets and turned them into a link, a little bit like a link you can click on an internet browser. So if you want to go to the financial scope sheet, all you have to do is move your mouse over that link, and you simply click on it, and it brings you directly to that sheet. So as I said, and I'll probably reiterate one or two more times, we really are trying to make it very easy to have multiple ways to move through the sheets in order to enter the data. So now I've entered the spreadsheet for financial scope. So this is a good example of the way all of the spreadsheet worksheets look. So I'll just go over that here. If you see that there's a number of rows with question numbers, and we're looking for measures. So here we're looking for the financial scope or revenue of a practice in terms of fee-for-service reimbursement. And then you can see a number of columns across the top. So the first is the survey answer. So if you remember in the survey, we asked just what's the percentage of your revenue that comes from fee-for-service arrangements. So that's data that you can enter that might make it easier for you to enter data in the rest of these fields. So let's say for your practice you get 60% from fee-for-service reimbursement. You put that in as a percentage. And then we're looking for data longitudinally, meaning for a number of years. And those years that we're focused on for the study are 2008, 2009, 2010, and 2011. And we also put in a column for pre-2008 data to help us understand, again, some of the transformation of the practices into PCMH, because for a lot of practices, that was the timing of transformation. And finally, if you look at column K, you'll see a field that says incomplete. So that helps to guide you to the rows that need to be filled in. Because if it says incomplete, then it means that there's still data to be filled in the spreadsheet. And I'll show you in one other tab how not every row has that incomplete in column K. So for example, you see in row 4, there's nothing in column K. So that just is another way to highlight that this is a heading, that we're not asking you for data. So I'm going to go in and just enter some example numbers. So let's say for this practice in In 2008, it took in $2 million in fee-for-service reimbursements. You would literally just type that in and hit enter. 2009, we could say was the same. Let's say 2010, it's now $2,100,000 in fee-for-service revenue, and the same in 2011. So now you'll see I've filled in all the years. I still haven't filled in pre-2008, and for that reason, it's still listed as incomplete. And again, for some of these questions, it might be hard for you to say, what was our revenue in any year, before 2008. And this is a tool, and we're just going to try to ask you to give us the best answer you can. So maybe you think that before 2008, like the year before, you had $1,900,000 in revenue. And if you just enter that in, now you'll see that cell K5 has toggled to being complete. So I'm just going to delete the entry for 2011. So you can see it's incomplete, and I'm going to re-enter the same number one more time. And I hit enter, and now you can see that it's complete. So as I said, we've tried to put in a lot of these guidelines to help you complete this tool and to fill in the data that we're going to use to determine the cost of the patient-centered medical home model. So now I'm going to go back to the navigation sheet so that I can show you the way the tool looks like for just one other sheet. So as I said, if you want to go back to the navigation sheet quickly, you can go and put your mouse over this blue button and click, and it brings you back to the navigation sheet. So the one other sheet I wanted to show you was the access and continuity sheet. So again, I can just click on this link and look at access and continuity. So you can see again that the sheet fills up more than the entire window, and since this is Excel, we can easily zoom out. And you'll see that the structure of this sheet is the same as the financial scope. So they all look like this. They all have a column for survey answer, and they all have a column for pre-2008, and then the years 2008 through 2011, and they all have a incomplete or complete toggle in column K. So if you're looking here, the first question that actually needs to be filled out is in row 5. Rows 3 and 4 are just blank. We did that to allow there to be headers. So within the overall standard of access and continuity, the first thing we're asking about is extended access in this sheet. And the first question is, to what extent did you offer extended hours, office hours, other than Monday through Friday, 8:30 to 5? So again, you can see that the first column, column E, is the survey answer, and it says choose one, yes or no. Because in the surveys, we only asked you a yes or no question. And you'll see that in Excel, once you've selected that E5, there's a little arrow down here on the bottom right, and you can click on that, and it will allow you to choose yes or no. That's why we put in that drop-down menu sheet. And it allows you to click one of these. So let's say for your practice, you did offer extended office hours, and that's what you said in the survey. Again, we're not trying to recollect the survey data, but just by having your answer here and having that survey in front of you, that might help you to answer the questions year by year. So once you've said yes, you did offer extended hours, then you're going to look in each of these years and choose one, and these are all extent questions. So what that means is we're asking you to choose, this is something like a scale from 1 to 5. But instead of having to enter a number, you can actually make a selection. Not at all, to a little extent, to some extent, to a moderate extent, or to a large extent. So let's say before 2008 for this practice, extended office hours were offered to a little extent. Maybe there was a after-hours answering service, so you would just click to a little extent. And again, suppose for this practice in 2008, I'm just using the arrow keys to move over literally one cell to the right. Perhaps this practice extended their hours to a moderate extent in 2008 and 2009. And then in 2010, they made a major change, so they have very a large extent of extended hours, and the same in 2011. And you'll notice that when I choose to a large extent here, cell K5 will toggle to complete. Let me show you that again. But here, first it was choose one, and it's incomplete. And then I say to a large extent, and it's complete. Just as a reminder, this is a research tool. So just like with the survey, the answers are based on your practice and your experience. And while we're certainly available for help with the tool, we really want you to answer this from the point of view of your practice. So at least for the purpose of the orientation, I'm going to try not to give any specific examples so I don't bias your answers. It's really up to you to choose what do you think is the answer to this question. So then I'll just show you one more question. The next question, what were the additional expenditures for running the practice during expended hours, meaning spending on extended access less the reimbursement for those visits? So maybe in the survey, this isn't even a cost that you identified, so you might put in 0 and 0 for pre-2008. So suppose for this practice they can identify some specific fees that they had to pay. Let's say facility fees to the management where the practice is run. So having extended hours to a moderate extent costs $10,000, then they would literally enter $10,000 here. And then the same for 2009, maybe it's the same amount. And let's say in 2010 that doubled, so now it costs $20,000. You would enter that and just take a look at K6. You'll have the same toggle. When I hit 20,000, now it says complete. So that's an example of both of these types of questions, the ones with the drop-down menus and the ones with the free response, essentially, where you can put in a dollar figure. And this is the change that's going to allow us, again, to impute the cost of transformation and sustaining the PCMH model to those specific clinical activities that we assessed in the survey and in the semi-structured interviews. So just in the example of this practice, we would be able to say that sustaining the model for them meant offering more expanded office hours, and there's a tangible cost to that of, in this example, $10,000, because it changed from $10,000 to $20,000 from 2009 to 2010. That's the value of having this data over time. So at this point, I'm going to go back one more time to the navigation page. And as I said, this is Excel, so one other way to move there is to look at this left-facing arrow with the bar and click on that, and it brings you all the way back to the left, and it gives you the navigation sheet. And if you look at cell C5, you'll see financial scope is still incomplete because we only put in a few answers. We only answered a few of the questions. And the same for cell C7. We didn't go through the list of all the questions in access and continuity. So that is still listed as incomplete. So that is that's the way that the entire tool works. So at this point, it's not a valuable use of time for me to go through each and every one of these sheets. As I said, each sheet is designed with a very similar format to facilitate that process of entering data. You can obviously save this and come back to it another time. For example, I'm going to go right now to the File menu, and I'll say Save As, and we'll save this as _ 6/18/2014 RDL, which is my initials. So you can save this. Just hit continue if you get any of these errors. You can save this and come back to it. You don't need to do it all at once. And as I said, we're open at any time to answering questions about specific data elements. This was designed to be a tutorial and orientation to the cost tool. So you can see the format and understand it better in order to fill it out.